I think we're now approaching 20%. I think it's been steadily going up, and I think it will continue to go up as we get more sophisticated with how we treat cancer and other diseases like that. But for example, the newest chemotherapy drugs cost up to 2.5. I saw one cost $5 billion to get that to market. And one treatment regimen was costing $1 million a year per patient. So the more sophisticated we get with promoting health, or treating disease, I should say, the more it's going to cost. And that's why we, in this group of people that believe in whole food, plant-based nutrition, that we know, based on reversing of heart disease and cancer and type 2 diabetes, that particularly in the first and the last, the heart disease and the type 2 diabetes, they're reversible about over 90% of the time if people shift and stay with a whole food, plant-based diet. So all in all, if everyone moved to that diet, the cost of health care would probably drop 80%. And the only kind of doctors we would need would be the acute care doctors when we injure ourselves, or we'd need cosmetic surgeons and obstetricians and the good kind of doctors, the fun doctors. But our healthcare system is out of control. It's money motivated. We don't teach doctors in med school how to promote health. We teach them how to treat disease. Doctors, I think they're a great bunch of people that all went into the profession basically to help people. And I just feel for them when they find out they're trapped in a system that means they have to visit with patients who have already been sold on a drug before they got there. He's got 7 minutes, he or she's got 7 minutes with that patient. And even if they wanted to convert them and help them promote health, they wouldn't have time. And if they did convert them, the patient wouldn't come back again because they would get healthy. So the whole system is an absolute mess. It's not getting any better. This Biden moonshot cancer initiative, they're not stepping outside the cancer castle, as Dr. Campbell calls it. Those are people who specialize in cancer treatment. Nobody in the cancer industry, according to my research, is actually searching for a true cure of cancer. They're searching for ways to treat cancer that will go on for as long as you live, and hopefully they'll keep you alive long enough to extract a lot of money from you, your insurance company, your government. So I hate to use only, but the only pragmatic way out of this mess is a huge change in diet, and the special interest of the food companies, the pharmaceutical companies, the overall way Congress works, being held accountable to their constituents. Just not popular to talk about giving up meat. And until something big happens, and in my mind, I just spoke about this earlier, the way out of this whole mess, which also includes environmental disasters, is, I think, a massive global awareness campaign, taking the message about what we're doing to our bodies and what we're doing to our planet, taking that message directly to the people that are eating most of the harmful products for ourselves and for the planet, and explaining to them what needs to happen. And I think that kind of process, led by a leader that's as passionate as I am about the topic, but has a few more $1 billion than I do and has global name recognition. I think it boils down to, one person with the right level of conviction and the right amount of influence ability could change the world, because that person could build a team and could organize a global awareness campaign. Now, people ask me, well, how much would that cost? And I said, well, everything is relative. And I see where Facebook just bought a company called WhatsApp for $22 billion. Now, a good portion of the world's population don't even know what WhatsApp is. It's an app for your iPhone or your smartphone. And if an app for a smartphone is worth $22 billion, what is the future of our civilization worth? So it really boils down to that, and I don't like to sound like I'm talking about doom and gloom, and so I always interject the fact that I've sorted it down to 4 key categories of unsustainability in our world. The first is overpopulation. We're growing at the rate of over 200,000 people a day. During this 10-day conference, we added another 2 million people to the planet. Secondly, the way that population lives, the way we consume stuff. We have a global economy based on the maximization of the consumption of stuff in a world of finite resources. And thirdly, you take those first 2 problems of an ever-expanding, exploding population, coupled with the fact that people are moving up the food chain all over the world. They're beginning to drive cars for the first time. They're beginning to eat meat for the first time. So we have an explosion on all these fronts. And those are driving number 3, which is our burning of fossil fuels. All of those things take fuel. And we're nowhere when it comes to replacing fossil fuels with the renewables. So those are the first 3 areas. Here's the good news. The good news is that changing what we eat on a massive scale is possible to happen very quickly. I say it's possible. It is impossible to change the way people move around the world very quickly and change it from one that consumes a lot of energy to one that, is total mass transportation. So it's the only thing that we can do quickly. The other 3, I say, would take many decades, if not centuries, to fix, and we just simply don't have that much time.